Hi, friends. Welcome to the Better Birth podcast. We're so excited to have you. I'm Amelia, Head of Community at Anja, and I'm joined, of course, with my co-host, Kathryn Cross, who's the founder of Anja.
Yes, happy to be here.
Yeah.
So today we are going to cover how to advocate for yourself. I think this is really important in healthcare broadly, regardless of what you're being seen for, but especially in pregnancy and birth, there's so much that's a part of the unknown that being able to advocate for yourself is especially important. So one thing that I spoke with Amelia about, Amelia is a certified doula in addition to our head of community. And so she has a lot of great birth knowledge. So we have a couple of things that we have historically seen, or Amelia has historically seen people really advocate for themselves for, and when it's really important for advocacy to be in the picture. So the first one that we wanted to cover was a pelvic exam. So what have you seen in the pelvic exam realm, and why do you think advocacy is so important in that particular exam?
Yeah, I think informed consent is the biggest conversation to have when we're having conversations about pelvic exams or any form of exam, really, especially when you're dealing with an area of your body that feels more private, as with pelvic exams. I think a lot of it is having communication early on with your provider about what goes into that exam and what to expect, and even having the conversation of like, can I insert my speculum myself so that it's not something that's being done to me, but it's something that I can do on my own, and having those conversations with your provider about like what works for you and your body and your hard limits, and sometimes even having a code word that you have with your provider, just saying like, okay, this is, if I say this word, like I want you to stop everything immediately. That's a huge piece of just like starting the communication early on and advocating for yourself. It's just like having those conversations, but it can be really hard. So be patient with yourself for sure. And a good provider will definitely like have those conversations with you and be willing to talk to you about your hard limits.
Cool. Why do you think a pelvic exam is so necessary?
So pelvic exams can be, done to, just check on your like overall health of your vaginal canal, your anal area, that like all of that stuff is like, it's very sensitive and it's hard to have those conversations and have those exams done, just because it is such like a private part of your body. And so I think that's, it is important for preventative care to have, pelvic exams, and they have to do a pelvic exam to do like a pap smear or any sort of like testing, or if you have any specific concerns about your pelvic health. I think, it is definitely something where you can talk to your doctor about like what is actually necessary in this realm and in this space. Do I have to have XYZ exam done today? What are the pros and cons of, foregoing this exam? And just like having a general conversation about why those things are important. But if we're looking at preventative care for, cancers and any sort of infections and things like that, you definitely will see more usage of the pelvic exam in those instances.
Yeah, for sure. Yeah, even yesterday I was talking with one of my friends who has been having a lot of like vaginal issues and things like that in the past. And she was saying that like every time she goes to the OB, she feels like really sad because it's so painful every time they do a pelvic exam for her. So yeah, I feel like it's really important, and she's never really felt like empowered at the OB/GYN, and I think she's just grown to hate it.
Yeah, I think something that could be extremely empowering for a person who has just like a really hard time with pelvic exams in general, or just doctor's visits in general, it can be kind of scary. And we can talk a little bit about power structures and how those hierarchies of kind of structure can affect like how confident and how safe you feel in a medical setting, and how that we can change the trajectory, and how providers can even start that conversation with their patients. Some providers do a really, really good job of this, and it's always something where I'm like cheering them on when I see those conversations happening. But definitely look into getting a speculum yourself and becoming more comfortable with your own body before going into those settings. Because if the only time that you're ever encountering those sort of sensations is in just kind of a setting where you're very tense, it's going to be more painful. It's going to be feel awkward. I think understanding that, medical providers are seeing hundreds, if not thousands of patients on a regular basis. and doing these exams for many people, it's kind of just second nature to them, but sometimes they don't realize like how kind of cold and like harsh the sensations can feel on your body. And so doing what you can to like, we have to have sterile things so that we're not introducing bacteria and things into your pelvic area. But if we can have those conversations early on about, okay, what can I do to maybe like warm the speculum and make it a little bit less harsh? What can we do to kind of like make myself more comfortable? Turning on a playlist and putting in headphones,
Mhm.
deep breathing, using some like meditative practices in the space, asking your provider to communicate every step of the way. And then, if you do have the ability to get a speculum to practice at home and just like really experience what it feels like for that to be inserted. And it could just like take a lot of the fear and just kind of normalize the experience a little bit. But
Mhm.
at any time during any procedure, if you feel unsafe or you're just like, nope, I can't do this, it's okay to opt out as well, and try again another day.
Yeah, for sure. I remember the first time I got a pap smear. My doctor was saying that we could do it another day, but yeah, I don't know. I was kind of like freaked out. I didn't know what to expect. But she was like,
Yeah.
it's fine. It's probably not going to be painful. So yeah, and then it ended up being totally fine. So I was glad I did it that day and didn't have to come back later.
Yeah, definitely. I think I think it's nice just to kind of like get it over with. You can take some like over the counter pain medications ahead of your appointment to kind of reduce kind of the any pricks and kind of that feeling. Your provider should be talking you through what to expect, but
Yeah.
some providers, especially if they're male providers don't have never had like a pelvic exam in the same way, and so like they can like be very unfamiliar with the sensation. So I've had a little bit better success with like a nurse midwife doing a pelvic
Yeah.
exam than I have. They're just more gentle. They talk you through it a little bit more. They're like, oh, you're going to feel the sensation in 3, 2, 1, count you through it. And it's having a pap smear with them is obviously like, it's been a better experience.
Yeah.
Um, another instance in which you might experience a pelvic exam is, of course, in pregnancy,
Mhm.
checking the cervix and making sure that that's all closed and that everything's looking normal. And also like for an IUD insertion or anything like that. So all of those are instances in which they might use a pelvic exam, ahead of time. Also in fertility medicine, when I was doing some checkups at a fertility clinic before we had our daughter, when we were trying to get pregnant and having some like complications with the process. They did a lot of pelvic exams just to kind of like check for any like weird kind of like anatomy pieces that they might want to be aware of to try and figure out kind of like if there was something going on. And so there's a lot of different instances in which people might experience a pelvic exam. But just like, yeah, I mean, honestly, having those conversations, like we said a bit ago, is probably the best path forward. So your provider's communicating with you well.
Awesome. Cool. Well, yeah, that's definitely super applicable, even for like non-pregnant folks.
Yeah.
Um, so something that is a point of contention on my TikTok very frequently amongst those who are pregnant and not pregnant is a vaccine schedule and how to advocate for yourself there. So I remember once I made a video just outlining the exact like CDC recommendations for babies' first vaccines. And I got like so many comments about like vaccines causing autism and vaccines being like really bad for your body and like delaying vaccines as well. So curious on your take regarding the CDC's recommended vaccine schedule, delaying vaccines, and just like a sense of being empowered with science as well and advocating for yourself in that arena.
Yeah, 100%. I have been on both sides of the spectrum. I think that's a very unique place. I grew up, my parents were anti-vax. We didn't go to the medical providers. We didn't have conversations about vaccines in a positive light. Everything was very negative. A lot of misinformation that just wasn't backed by data has been passed around, and it's created a lot of fear. And I think for good reason in a lot of families. I think historically, the medical community has not done well when there has been an instance where a family has had an adverse reaction to a vaccine. And so people don't, there's a lot of fear there as far as like, will this affect my baby negatively? And then, there's some things where unfortunately like signs and symptoms can like align. Um, in a way that makes things seem suspicious. For example, when they do diagnose autism, it's typically around 2 years old that they start to like first do screenings and things like that. And that is kind of correlated with the timing of like 2-year-old vaccines. And
Right.
so a lot of families start to, they get the diagnosis around the same time that they had an MMR vaccine, and the baby maybe got a fever because a vaccine does cause an immune reaction. And that's the goal, is to cause an immune reaction so that the body builds antibodies. When I had my daughter, I did the CDC vaccine schedule on schedule, and we just like monitored afterwards. She never had any adverse reactions. We treated with Tylenol a few times if she had like, spiked a fever or something, but mostly she just slept. She's a pretty healthy, robust, very healthy kid just across the board. And so there was never any concerns of like us, seeing anything that was concerning to us. If a family does see something that's concerning to them, definitely don't, I guess, like step into that space of like just like fear. Start a conversation with your provider about, maybe we can slow things down. Maybe we can do fewer vaccines in one visit. Maybe we can spread them out a bit. There are some providers who are very comfortable with doing delayed vaccine schedules or doing a limited number in a visit. Some prefer to do them, according to the CDC schedule exactly. There's good reasons for both sides of I think good reasons for both sides of the story. I think realizing though that your baby's likely going to come into contact with those, a lot of other things that are boosting their immune system. There's in larger numbers on a day-to-day basis than the 3 or 4 antibodies that they're coming into contact through a vaccine. And then also like at birth, another story, I guess we could like another thing that we could lean into as well is like the vaccines that happen immediately at birth, because I think that's a really relevant. So a lot of times at birth, they'll give your baby erythromycin ointment, which goes across their head, that across their eyes. That's not a vaccine. That is just to prevent like microbes going into their bacteria to get into their eyes that can cause blindness. It's a very rare instance, but it's definitely something that has happened that's made it common practice in all medical offices. There aren't really like side effects of that. It's just kind of goopy, and after like 30 minutes, they just wipe it off. Some people choose to forego that. There's also the vitamin K vaccine, which is not actually a vaccine, it's just a vitamin K shot. So there's a little bit of misinformation. Sometimes people get that a little mixed up. The vitamin K shot just gives the body the ability to be able to do blood clotting. So to prevent brain bleeds in early baby days, before the body starts to kick in and develop, those like blood clotting and kind of like building up the vitamin K stores on its own. And then the third is the Hep B vaccine. So they give the Hep B vaccine at birth. And some families choose to like opt out of that and wait until the first pediatrician appointment. We got ours at the hospital. It was just very convenient. Get it all done at once. They just do that in the leg. Most baby vaccines are done in the leg early on. But if you have any concerns and you've read information online, you're trying to get to the bottom of it, definitely go to evidence-based sources. Evidence-based birth has great information about either sticking with a schedule or doing delayed schedules and the pros and cons of that and the data behind it. I think we as a society are very privileged to live in a time where vaccines are readily available for families, and we don't see the effects of life before vaccines, when there was really high infant and childhood mortality. And so we're living in a very privileged time. And I think that there's the I guess like roadmap to where we've gotten with vaccine hesitancy is there's a lot of misinformation online that's being spread. And it's really hard for folks to feel 100% confident in their choices if they're not, confident in the data that exists. And so I always like veer away from fear mongering about things like vaccines, because the risks of adverse effects for most of them are much higher than the risks of the actual disease, and the risks of getting that disease and the long-term effects on the body.
Yeah, for sure. Yeah, it's kind of interesting. I honestly didn't expect such an adverse response. I feel like the like anti-vaxxer crowd is louder than like those that do get vaccinated, although they seem to be in a minority. So Yeah. What in particular was it that made you feel less skeptical of vaccines and sort of veer away from what your family believed?
Yeah, it's kind of a long conversation because um growing up in just like a household where we just like trusted naturopathic medicine and supplements and vitamins and eating organic food and et cetera, over like the medical community, um, kind of came from a religious basis, which is probably not unheard of for many families across, the US. But um, when I became an adult, I started to really look into science and data and really got into enjoying reading about breakthroughs in science and kind of like where we've come from and where we're going. And of course, that brought me into the work that I'm doing now with Anja, which is very exciting. Um, but honestly, like seeing some adverse reactions to not getting vaccinated, as well as some, anti-medical sentiment affecting the life and well-being of some of the patients that I was working with as a doula, really stopped me in my tracks and kind of just set me back. I actually took a Coursera course on reading data and how to like analyze like misinformation. And that
Mm.
changed a lot of my trajectory in the future for like how I observed data and how I looked at it as like, how do you actually evaluate the pros and cons? How do you look at things and say, okay, the chances of an adverse effect of getting the disease and having, death be the, of course, is the worst case scenario, but even long-term adverse effects on the body without the vaccine is 1 in 100 or 1 in 500, and then with the vaccine, adverse effects of the vaccine is 1 in 5 million. That's a very like, it's hard for people to really understand the data of what that looks like until you can visualize it. So that became kind of the trajectory that like pushed me in that direction. And just like how do we visualize data? How do we have conversations about this? How do we break down those like hard conversations into productive conversations where we're not getting everyone fired up and just like debating back and forth, because we're not changing anybody's mind, right? When we're just shouting into the abyss at each other. And so I think like coming back to the pros and cons and validating people's experiences, and also like why they're fearful of the medical community and like what the medical community has done in the past that makes people look at them fearfully, especially for marginalized communities and people of color. There has been a lot of really hard things that have happened to them as a community. And, whether it's medical providers doing forced hysterectomies, non-consensual hysterectomies, or, putting things into, putting things into, their bodies that they didn't consent to, and just kind of dismissing their trauma, is not doing us any good. It's not helping the conversation, and minimizing that has happened in the past minimizes people's experiences, and that's not okay. And so, like, if we want to have conversations that are actually productive, we have to be transparent about harms that have been done in the past and what we're doing to correct those harms for the future. And how can we, as humans, see another person's humanity, even if we do observe them steeped in what we consider misinformation, or them being swayed by a misinformation campaign. Really just seeing like at the heart of like, what are their human experiences? What have they experienced that's caused them to come to that space? And how can we start the conversations from that direction of like, I have your goodwill in mind, and I don't want any harm to come to you. Yes, you're an autonomous human who can make your own decisions, but for the greater, good of all humanity, like, we have to have a conversation at some point. We have to have a day of reckoning for like how misinformation is being spread in our society. I'm not sure that we're ready for that yet.
Yeah, maybe after another presidency.
Maybe.
Okay, awesome. Well, yeah, I think another like really important part of advocating for yourself that's especially relevant for our community is your birth plan advocacy. So, as a doula, how did you help inform folks' decisions around their birth plan? And how did you go about advocating for them and encouraging them to advocate for themselves? Is something that I'm really curious about, especially because whenever people ask me what a doula is, I always tell them like they really just help you advocate for yourself. And so like you become an advocate, but then you're also like a mechanism of empowerment.
Yeah, definitely. I feel like for a big part of it, a doula is just somebody who's been to births before. So they've gone along this path with many other families behind you. And so they're bringing like a lot of experience into one space, right? And so they've seen things, they've observed birth. The birth is a very normal experience for them to like see and observe. So having a doula on your side can really help you advocate for like what's normal and like help reduce fear and help reduce that sense of overwhelm of just like, there's so much information. What's important for me to know? And so I think really identifying what your end goal is, like with your birth, with your postpartum, like what do you want? And then working your way backwards. And so also just like helping you identify the pros and cons of each space, looking at your own risk assessment for you as an individual rather than as just a number on the patient roster. And then really giving you a list of questions that you can take to your provider to make the best use of that short amount of time that you're having with your provider. Early on, it's around, once a month you have a check-in, and those visits can be as little as 10 minutes with your provider. And so you want to come in prepared to have the questions that you need answered. And then so your doula can kind of like help you navigate that. And as you craft your birth plan, how to communicate those things back to your provider so that they're getting the useful information that's beneficial to them, that they can know, to put in your chart, to have those conversations, to do testing the way that you would like testing to be done, to help you understand, what's going to happen and kind of like what the process of birth looks like. In our culture and in our society, we don't talk about birth. We don't have birth education. We barely have sex education in most spaces, and we don't have much education on birth control and pregnancy and birth and what that looks like in parenthood. And so for most folks, it's a very like foreign concept. And the conversations that a doula can have with you is just really normalizing that process of the different stages of labor, all the way through to, what to expect in the immediate postpartum, like how long are you going to bleed and all of those things, and really help you craft your preferences so that when you're coming into that space, you know what you are wanting, and then your doula can also echo those wishes to your medical staff and the people around you. I think this is the perfect segue into, hierarchy of care and how hierarchy of care exists within the medical system. So traditionally, the hierarchy of care in birth looks like the medical provider at the top, and then medical staff, your RN, your CNAs, and then at the very bottom of the medical hierarchy is the patient and their family. And we want to kind of change the trajectory on that. We want to change the conversation to how could we create circles of care instead of this like kind of like pyramid of care where the doctor's at the top and the patient's at the bottom. So we want to really have the conversation of how can we, have the medical provider in their space doing the work that they do best, keeping an eye out to make sure mom and baby are healthy, and just like watching the whole space, and then having your doula in your corner to like help you with the experience and the mental, emotional, and physical parts of labor. How do you move during labor to help the baby descend? Really empowering the partner to step up and be a support person for the birthing person, and just really be there, as a team member, and not just feeling like an outsider who doesn't know anything about birth either. So a lot of what doulas do is education and information, helping you come into sources of data. If you do want an epidural, when do you want that epidural? Do you want to like look at other options prior to that, or do you want to go straight there? Do you want to reduce your risk of a cesarean, or is a cesarean something that you're interested in? If you do want a cesarean, do you understand all of the risks that are associated with that? Because cesareans are a major abdominal surgery, which is often kind of overlooked as just like a routine procedure. And so the recovery is actually really hard for a lot of moms after birth, when they have a cesarean. And so just kind of understanding all of those different nuances and how those can affect you, and communicate them well with your provider. When it comes to communicating with your provider about your birth preferences, having the conversation early and often is ideal. We want to be having these conversations at every appointment, at every visit, of like what your plans are, what you're working towards, what your goals are, so that they can come alongside you in those goals. Having the first conversation about your birth preferences when you're in triage or in your birth room is not the ideal scenario. You want to have those conversations conversations, of course, with your L&D nurse who's there, but you want your medical provider who's like leading care to really understand what your goals are and to be a true teammate with you in those goals. And so like having that collaboration. As a doula, I would write introduction letters and send them with my clients to their birth provider, to like introduce myself, so that we could work in collaboration as a team. And I am a huge fan of having those conversations with the medical provider and really involving them and not being really intentional to not create an us versus them feelings of like conversation, but really just like, you're a very valid, important teammate in this goal. And like what you're bringing is just like years and years of expertise. And, having been to many births as well from a medical standpoint, and really just like leaning into that expertise is really, really valuable as a birth worker and as a parent to have that in your corner.
Right. So how would you go about providing that document, or like mentioning to your clients that you would want them to provide the document? Because I think one thing that I've always noticed when going to physicians is there just isn't like a lot of room for like passing along anything that feels outside of the protocol. Like I always felt sort of shy about it. So how did you go about just empowering clients to be able to put those kind of letters forward and really open up that line of communication?
Yeah, so ideally, I would come along with my clients to one of their prenatal appointments and actually meet their OB or their midwife ahead of time,
Yeah.
just to create that face-to-face connection and like let them know like we're all in this together. Like the goal is like this very collaborative working space where we're, just facilitating a really strong birth space for this person where
Yeah.
they feel heard and seen. And so having those conversations with the provider in the birth space and having, giving them a letter. Sometimes there was not the opportunity. Sometimes I couldn't make it to an appointment for whatever reason. With COVID, that's also changed some things, like if they have restrictions on how many people can come or if people can come into
Yeah.
a prenatal appointment. But yeah, the letter was just like something that I gave to the patients, and I gave it to them with their birth preferences. So after we would craft them in a prenatal, we would take all of the preferences that the provider could actually have any influence in, and we would put those onto a sheet. So we would delete anything that wasn't really something that the provider could make any changes on, just to kind of reduce the noise. We wanted it to be concise.
Mhm.
And then, so we would have the birth preferences, and then I would just staple the introduction letter of like, hey, like, this is who I am. Like the goal is, these are their goals. I'm excited to work in collaboration with you, and just like really, do our part to facilitate this. If you have any questions or if you'd like to communicate, here's my information. A couple of times I actually did have a provider reach out and say like, I'm excited to work with you. But oftentimes like, it was just like it made more of a difference in the actual birth space
Hmm.
on the day of birth, when the provider was coming in. They're like, oh yeah, I got your letter. Thank you so much for sending that over. And it just really creates, I think it's really important for doulas to, if you're a birth worker, to just really lean into collaboration and lean into, making sure that people are feeling the communication, and, the doctor and everyone there feels valued and validated in their role.
Right. Yeah, super interesting, because I feel like we've been thinking a lot about how to remind physicians about how to bank, and the fact that our clients do want to bank, and things like that. So yeah, I've been trying to think about what kind of like sort of abnormal things we can take part in to just add that additional reminder. But it also reminds me of Bennett Casper's IG Live with us, when I had a conversation with him about being a seahorse dad and being trans and pregnant. And he was mentioning that he would always have a packet that he would give out to his physicians. Anyone that he would meet, he would bring like dozens of copies of these packets, and just like bring them to like the nurses and pretty much anyone that he would meet, it sounds like. And it just contained like a bunch of FAQs about himself that he wanted them to know about his transition thus far, and just how his pregnancy is going and things like that, so that people would really make sure to treat him with care. And I thought it was so interesting because he does that, of course, because he's a seahorse dad. But I feel like if everyone did that, regardless of like their previous gender history or what have you, then they might feel much more confident in the zone of being a patient.
Yeah, I think that's huge. And I think it could be really beneficial if people just brought like their medical history in a short bio and just kind of like, this is what I need from you as a provider. I think that, with how fast paced sometimes medical visits can feel, it can be hard to feel like
Yeah.
you can accurately advocate for yourself. But if you can give them something that they can put in their chart, then when they're doing reviews later, they're coming into contact with that. With that, you can also include photos. I'm a huge fan of that. On like the letters that I would send, I would put a photo. There was one time I was in supporting another family, and a medical provider saw me in the cafeteria downstairs when I was getting lunch for the family, and he was like, I just got a letter from you, we like are sharing a patient. And it was just like a
Oh,
really cool experience, because there's that like face-to-face recognition of
yeah,
like, you're building everything about being a doula, being a birth worker, is about building community and building spaces where people recognize that, what you're bringing to the table is really valuable. Like, what the work that you're doing as a doula makes a physician's work much, much easier and less complicated and much less complex. And so when they really understand that, and they're feeling that collaboration of, it's not an us versus me versus you situation. It's
yeah,
it's very much a, we're working together. We have the same goals. We have, the same end goal. We want, mom and baby to be safe and healthy, and for their goals to be, validated and heard
yeah,
in that moment. I think any practitioner worth their salt sees that as a huge value. And I have had that be the experience for the majority of patients, is that their
right,
providers really, really want their good. And I think, regardless of how we see the system, there's of course negatives to every system that exists. There's definite negatives sometimes in the medical system, especially in, you know, policies and procedures that aren't evidence-based or that are very outdated, that we're still working really hard and building initiatives to increase, safety across the board for all families.
mhm,
Um, there's still so much work we have to do, especially for folks who, are people of color or marginalized communities, where their, maternal death rate is nearly double what that
yeah,
of, their white counterparts are. Those are ongoing conversations and ongoing work that we don't take lightly. And it's, there's just so much for us to do, but there are things that we can do for ourselves to, if we can increase advocacy and reduce some of those barriers, and just like become, activists in our own way, in our own corners, to increase safety and, really like make sure that people are heard and that their experiences are valid.
right, for sure. Yeah, on the topic of validating folks' experiences, in your experience when you've worked with people that you don't agree with, or even just encountered people that you don't agree with, on anything, like whether it be like moral, ethical, or like political or what have you, how have you dealt with just ensuring that they get the same level of advocacy and that they feel also empowered, even in a space where they might be a minority or anything like that?
I think this is a really, really important question, and one that often gets overlooked, is that when there are differences of opinion, I definitely had clients who birthed very different than how I would or how I did.
Yeah,
And they made choices that were very different based on their own experiences, right? And in those instances, it's really, really important to recognize as an advocate that your philosophy of birth, your beliefs about birth, do not matter in the birth space. The only thing that matters is a philosophy of care, of believing that every human is, deserving of the best support, of the best medical care, regardless of their beliefs, regardless of if you agree with them or if
right,
you would do things the exact same way. Your human experiences are so different. And there's, the human experience is very nuanced. There are times where you know, if there's a moral or an ethical question mark or something that I can't abide by, referring them to somebody who can support them wholeheartedly. So if there's something coming up where it's like, I can't wholeheartedly support this and feel really good that it's not doing any harm. I come from a standpoint of like, when we're looking at philosophies of care, as do no harm. And so if I feel like you're choosing to do something that's actively harmful to your child or to your community or, to your partner, like I don't think there's anything wrong. And I think it's actually very positive to have a boundary around that for your own
Yeah.
mental and emotional and physical health, right? And so if you're in a birth situation where you're just like, I can't support this for whatever reason, the important thing is that there's continuity of care and you're not dropping those people at the curb. So, making sure, that you're having those conversations early on in consultations. And if there's, a difference in philosophy that you can't work with, helping them find someone who can, because everyone's deserving of support. And yeah, it's basically no questions asked. Yeah.
Yeah, for sure. Yeah, not that Grey's Anatomy should be looked to for a sense of like reality in healthcare, but it reminds me of this Grey's Anatomy episode where they treat all the doctors treat death row patients. And some of the like death row inmates are talking about like the awful crimes that they committed and they like don't feel a sense of guilt and all these things. But the whole episode is just about how yeah, like everyone deserves healthcare regardless of like who you are and who you've been. So yeah, I think it's a really interesting note.
Yeah, definitely. I think we have to look past the person to see the human. In those instances that like every human, regardless of, their life experiences and what they've done, they're deserving of safety.
Yeah,
And, I think medical providers, a lot of, if they're a medical doctor, they've taken an oath
right.
to basically do no harm. And
Yeah,
so really leaning into that very actively is really, really important. And I think for doulas, we have to do the same. Like it's just the way that we care for people and the way that we do things is like, yeah, like everyone's deserving of support as they, go through birth. And I've worked with and had the privilege of like talking to quite a few doulas who work with, for example, inmates who are pregnant and going through birth and, advocating for them, things as simple as they don't deserve to be handcuffed to a bed while they're giving birth. That's
yeah,
inhumane. And they deserve to be, yes, we can have, do whatever we can for the safety of others around them. But, if somebody's actively violent, there can be individual conversations, but across the board, there has to be a level of humanity in how we treat other people. And, if you don't need to know information, if that information is not going to benefit you in how you support them, it doesn't really matter, right? And so, I stand and applaud every single birth worker or every single practitioner who's doing their part to make changes and make birth better for families, for birthing people, regardless of their socioeconomic status, what their past is, where they've come from, where they're going,
yeah.
and really just looking at like, how can we make spaces safer and better for families? We would love to invite you to come and join our Better Birth community. It's betterbirth.community if you're a doula, and anjahealth.com/community if you're a parent. And we are always thrilled to have more conversations with you about birth and advocating for yourself inside of those channels. And we've been crafting checklists for you for each of your trimesters, as well as for birth itself and postpartum and what should you pack in your birth bag and things like that. So we're really excited to help create some resources for you to utilize in your own pregnancy, birth, and postpartum.
Yeah, definitely. Yeah, I feel like Amelia sent me a study last week about how loneliness has increased for pregnant parents, especially during the pandemic. And so I think things like community is just one way that people can feel less lonely, but it's definitely something really important to think about, especially because I've spoken with a lot of our own clients as well, and I asked them like, do you know anyone else pregnant? And most of them say no. So I think, yeah, in these times, community can be really important.
Yeah, the transition from being, a single person or a couple into becoming a parent is a massive transition. It fundamentally changes so many things about who you are
Yeah,
physiologically. And there's just your priorities shift, right? And so friendships can also shift. And it's another chapter that you're stepping into. And so if your friends aren't, I think there's a lot of people who do have friends who are also pregnant, but there's plenty of people who are the first in their friend group to have children.
Yeah.
And it can feel like you're losing something in a sense. Like sometimes people notice that friendships kind of are just close after they have a baby, or people don't really know how to care for their friends who are pregnant and in the postpartum period. And we're just trying to change that conversation. Yeah, like Kathryn said, since the beginning of the pandemic, rates of loneliness, people who like regularly report being lonely as a parent went from like 30 to 40%, which is still a very high number, up to 50 to 60%. So the numbers are greatly increasing.
Yeah.
Um, Postpartum depression and anxiety for both parents is increasing. And people just don't feel like they have anyone in their corner for a lot of folks who, we talk to. And we want that to change. We want there to be spaces where you feel seen and heard and understood and safe ultimately, and somewhere where you can come and there's like no wrong questions, but lots of evidence-based answers and just like moral support for you as you go through your journey.
Right. Yeah, definitely. Awesome. Well, I've loved this conversation. I think it's a really important topic, especially in the US where healthcare becomes so complicated. So, yeah, thanks for joining today.
Yeah, this was a good conversation. Always
Yeah.
always happy to chat.
Well, okay. Well, see everyone next time.
Bye guys.